Improving in user experiences. That was the introduction of
industrial science and technology. It's an automated one.
Another one is physical file storage. Our documents.
Hi guys, my name is William Zamira. I'm doing public relations for Abina. Let me my first student to introduce herself.
My name is Cynthia Mabamba, Advocate and
Revoir. Seven. Okay, we have two tasks we want to present here. The first task, we are going to explore the behavior change and behavior promotion. First, let me explain about the behavior change and the other part, behavior promotion. How did my third interaction? So she's going to explain another part. Behavior change simply means that modifying of already existing behavior to another behavior. That means you change the behavior. Now in public behavior, we are talking about the changing of behavior from unhealthy behavior towards to healthy behavior. We are referring to say healthy behavior. What are they? These are behavior that can help your health be self or well-being. For example, doing physical exercise. Unhealthy behavior, we are talking about smoking, which can hinder your health. According to transbehavioral model, it is stated that once you want to change the behavior, there is some different stages. You see, you can't change behavior without stages. So there is different stages. This stage we are talking about the pre-contemplation. Let me break it into simple language. You firstly, before you change, before you start with this stage, there is something that you can discuss with your friends. Just because you know that smoking is very important, so you discuss and no, I don't know. Just try. So that situation is more about pre-contemplation. Contemplation is now you are gaining something from that discussion, and now you want to show. Yeah, that is the contemplation. You want to show, okay, just try. And therefore, stage number 3, you are talking about action. You take an action. If you want to try smoking, you can get cigarette another time. So you try it. Then you maintain your behavior. But remember, our program is just towards changing unhealthy behavior to healthy behavior. So if you want to change unhealthy behavior like smoking, so you address those issues that you know that smoking is very dangerous for health. So if someone no, I don't know. So you convince him, persuasive communication. Then you try to change. Okay. For this time, let me allow my first introduction to explain about more health promotion. Thank you.
okay, health promotion, it much refers to the efforts to improve the health of community and individuals. It focuses on the prevention, education, and the behavior change. And it goes beyond treating the illness to promote the well-being of the individuals. There are approaches to health promotion. The first approach to health promotion is the biomedical approach. Biomedical approach, it focuses on the prevention and the treatment. On prevention, there is providing of resources to prevent the disease, and when the disease is there is the treatment by giving medicines and others. And the second approach is behavior approach. The behavior approach, it encourages healthier lifestyle and habits. On the healthier lifestyle is about doing physical exercise, eating healthy foods, and safe drinking water. And the third approach is the social and environment approach. On social environment approach, it starts on the social and the environmental changes. And there is the example of health promotion. The examples of health promotion are public health campaigns on anti-smoking and drug and substance awareness, giving people advice and providing them with telling people about the risk of taking drugs and substances. The other example is the vaccine campaigns. On vaccine campaigns, we provide immunization to prevent the health of people. Then, third example is about sexual health education. On sexual health education, we provide guidance to youth and we provide information to youth on STIs, contraceptives, and safe sex practice. The last example is about health school education. On health school education, we tell children at school to practice hygiene and eat good foods.
According to that scenario, we have also another way, which is was to explain medical sociology by the CPO. Now, this question is towards to sociology, whereby studying of human behavior and its origin. But according to medical sociology, that's the study of society or human behavior and health, because we are just talking about the medical. Now, that CPO, it explained that according to Taco Person, it was discovered that the CPO, once you get, it's like expectation whereby society behave on you once you get ill. Not only that, but we were talking about you. Once you get ill, you don't blame yourself. That's according to some person. And we have two things whereby we are going to tap those things. First thing, we are going to handle it, such as likewise we are talking about lights.
Okay, we can be very question. We are listening. We are taking your attention. So I'm going to be waiting right there.
Yes.
Yeah. And Mr. Salawati, just because when you go to have a limited time, but yes, sure. I'm very well.
And time is 1 minute.
Okay.
Once someone gets ill, you do not blame yourself. Responsibility, if someone gets ill, you're supposed to have or seek medication from the doctor. That's all. Thank you.
Alright, fine. So thank you so much for integration. Group now time for questions from the students. If you have any questions, just ask. Behavior that the first question is contains behavior change and the behavior promotion. The second one is about the sick role in security and health, and which we should avoid unnecessary movement. We disturb our friends. Any question, guys? Or in time for lecturers, if you have any question?
On my part, before I begin, let's give a good approach to the teamwork. Okay, so my few remarks is this guy, they have done what is their feedback. When they were explaining to me, I was vividly able to hear them, whatever they are talking about. I just encourage you guys to continue what you are doing. If we are at an interview, we have had a chance of being one, continue doing that. And at the same time, you have impressed your team, Mr. Marwan. That is what you feel one. So, all students, let's emulate from these guys. Whenever you are presenting, make sure you have done a number of words research. Make sure you are also giving what differences. You have heard they are saying so, meaning they are pointing to the content who wrote that one without what plagiarizing. Simple.
Yeah, so question. Going to us about how can change the behavior of the person, and you have told one of the stage you are saying pressure. So I just want to know, is there any intervention that we can implement on the first stage? Or is there any awareness that we can implement on the first stage of pressure?
Yes. First thing you can say, you can have motivation.
What about pressure?
Yes.
You can have motivation.
Yes.
I'm sure.
Yeah.
How sure?
I'm sure because in concentration, despite not you are not take action, but there's something you are just discuss. So on that scenario, you want to give them information, lead them on that they are going to change. That's the motivation. You motivate them, then once what you motivate them, they will not change or they might be seeing the content of what they are going to change. Otherwise, without motivation, you can't change something.
I think you're not kidding me. Before I come to your explanation, let me ask you another question. Is there any intention that a person can change the behavior of the first stage of the pressure?
Yes.
Is there any intention?
Yeah.
I should.
Yes.
Yes, bring something which is good, which is to pressure. But what we are spreading, that's not the likewise. In interpretation, there is no intention that someone can take that behavior, or there is no any awareness. They're just discussing, no anyone awareness. Now getting me? Yes, sir. Because we have contemplation, action, and what? So in contemplation, there is no awareness, there is no invitation for someone to change. But thanks for bringing this thing to, as I see, my fellow Rachel Utria has already said. Thank you so much, sir. Last question. What's the role of health care providers in the legitimizing or delegitimizing according to this law? Role of health care providers in legitimizing or delegitimizing according to this law?
Thank you. According to Sir Person, the law is just to understand the physical, not physical, but social factors such as economic, education that can affect health. That's the law to understand. That's the law of that I want to see in this slide.
So you mean that if you are health providers and you need maybe to give a treatment to someone, you should not look the factor of economic factors?
But first of all, you need to understand the situation. Then you come up with intervention. Because you can't give intervention without understanding the problem.
Maybe accident for inpatient or maybe they did by a woman, they wanted to do a mobile is also another surgical services. And the first point is tertiary care. On tertiary care consists of specialized hospital that provide advanced or diagnostic treatment and rehabilitation services. In rehabilitation services, we have physical therapy, speech therapy, psychological rehabilitation, or I can give you the meaning of rehabilitation. Rehabilitation refers to the care services that are given to individual to regain or repair the loss of an impaired illness or cognitive ability. That's all.
That focus on primary care and home-based care. Also to come up with providing every changes and then financing what possible. That's all.
That was our task giving. So we can now pass to our fellows or our fellow students.
Right, thank you for the session and session group. So it's time for questions. So the first chance to be given to the interaction. If you have a question, please answer. The question, it was describe the organization of healthcare system and health services in Ethiopia. Describe the organization of health system and health services in Ethiopia. That was the task. So intellectuals, if you have a question, students, you might just ask a question.
As in public health clinic.
Public health clinic. We are here to present on describe the organization of the health system and the health services in Ethiopia. So, first of all, I will come with introduction.
Once again, the question.
Describe the organization of the health system and the health services in Ethiopia. So, first of all, I'll come with introduction. The organization of the health system and the health services in Ethiopia is structured in legal system. It is there designed to improve accessibility, equity, and equality in health care. The entire system is supported by organized level. Here are the breakdowns of each organization. The first is the primary level. Primary level it has 6 supporting points. The first point is the health post located in each table. It is a smallest administrative unit served by the extension ward. The second point is the health center. Services by the health post is providing our patients care and the limited inpatient services. Primary hospital. It serves 200,000 people with general, medical, and surgical care. That's all.
Second point is secondary care. But involves inpatient and outpatient. For example, surgical services, emergency care, and basic specialists. This is due with the maybe in a medium way of providing services to patients that are capable of going to the hospital in Ethiopia. And the first question was I'm starting again. The second point is secondary diet. Secondary diet involves providing inpatient and outpatient. For example, providing surgical services, emergency care, and the specialist services.
I'm doing public health epidemic.
I'm Maria Ndimba, public health epidemic.
I'm Grace for example, doing public health epidemic. Okay, we are given a task to research on understanding basic factor that influence health services coverage and distribution in Ethiopia context. Before I proceed, let me to clarify on the meaning of health services coverage. Health services coverage. Coverage. Okay. Health services coverage means how many people are able to get health care they need, like going to the hospital, getting vaccine, medicine, or help during pregnancy and childbirth. There are several factors that influence health services coverage and distribution. This includes geographical barrier, cultural and social factor, shortage of health workforce, and the language barrier. On social and cultural factor, some people in Ethiopia prefer traditional medicine or religious healing over modern health services. This can stop them from going to hospital or clinic even when they sick. Next, language barrier. language, Ethiopia has many languages. If Ethiopians don't speak local language, some people may not understand information they are given, which makes it harder to them to use health services. And another factor is shortage of health workforce. Without enough doctor, nurse, and health care, many health centers can't open or even help people who need care. In example, in a place with a few health workers, patients have to wait for a long time to assist medication or treatment, which make their illnesses worse.
Okay, another factor is geographical barrier. Geographical barrier is the urban and rural area. In rural, large portion of Ethiopian population lives in rural and remote areas. Remote areas are large. Remote areas are regions that geographically isolated and difficult to access social services. For example, healthcare, education, and government. In conclusion, addressing these factors in a cohesive manner is essential for improving health services coverage and distribution in Ethiopia. Government initiative, donor support, capacity building effort are all crucial components in creating more equitable and effective social services.
What defines your presentation now is the question and question.
What are the challenges that people in Ethiopia may face when choosing traditional medicine over modern medicine?
The last question.
What are the challenges? Using tradition over
Okay. Traditional medicine, my example is like my herbs. For example, for a person using HIV, maybe they use my herbs to treat their disease. The results, they add the admission of other several diseases in their body. Then when a person use antiseptics, is able to get a better medication or assistance.
Was present on the contribution of sustainable development goals in relation to public health. So, sustainable development goals, these are just like the vision. And the sustainable development refers to development.
that
What movement of figure jump? Introduction.
sustainable development is development that
Oh, can someone give us an introduction so that we can just introduction? Someone can take an introduction,
Sustainable development goals. These are the development goals that meet the needs of the present generation without compromising the future generation needs. So, we're going to talk about the contributions of sustainable development goals to the world in relation to public health.
this goals was established in 2015 and it will be there up to 2030. So let me start with goal number 2. Goal number 2, which is improve health and well-being at all age. So this goal improve access to healthcare, such as skilled-based attendance. Skilled-based attendance, this refers to the presence of professions which are qualified to help in the pregnant women during delivery. And for example, doctors, nurses, or midwives. These can provide treatment or any care to newborn babies. Goal is zero hunger, which is goal number 3. This goal helps to reduce malnutrition diseases and improve food security. For example, supporting food programs such as ODF program. These provide food in schools for the children who are can be under 5 age, or in governments they provide porridge. So this food can reduce nutritious diseases and improve the health of children. So I can give the floor to my fellow. Thank you.
I will continue with goal number 6, access to the water and sanitation. Access to water and sanitation plays a vital role in preventing oral disease. Access to safe water and adequate sanitation reduce illness such as diarrhea and cholera. Another goal is climate action, goal number 18. Climate action addresses environmental threats that affect health. Climate change contributes to extreme weather, poor air quality, and the spread of disease such as malaria.
So I'm going to proceed with the contributions of Sustainable Development Goal to the World Nation to Public Health. So I'm going to start with Sustainable Development Goal number 1, which is to end poverty. No, poverty is the foundation of good health for good health. Poverty limits the access of nutritious food and clean environment. People living in poverty are more likely to suffer from preventable diseases.
Examining behavior and institutions. Sociologists use social organization and systematic factors. Okay, let me start again. Another law of sociologists is examining healthcare and institutions. Sociologists review the social organization and systematic factors. Here is how sociologists examine health systems in the society. Sociologist focuses on power dynamics. This power dynamics is how some people take power on others, like doctors may take power over patients, insulting them, not treating well. And also communities or patients may take their power over health workers. Another one is sociologist also focuses on conflict and collaboration between health workers and public health. This focuses much on how people interact in the society or how they interact when a profession comes to interview them. Some communities may not allow a health worker to educate them, or some health workers may not allow to go to rural areas because of their status. That's all I have on sociologists.
Another law of sociologists is that they focus much on social determinant. As a sociologist, the work is to make sure that there is availability of healthcare and the access of the medication and good houses. So the sociologists they work to focus that there is good access of healthcare and if professionals is people are the doctors, nurses, and so they make sure that they encourages that there is a bit of good healthcare and the good housing. So that's what.
The reason why this system is a key thing in security is that it is because of legal systems. It is a key of is the side of social interaction and relationship between health providers and patients or family organizations being treated. It is considered that in the hospitals, the health professionals are having the good communication interventions when treating them, especially those with chronic diseases. They need to be treated with love, care, and attention. So this key thing is to consider there is a good communication style between the health providers and the patients being treated. Yeah, that's all.
See the takers.
And then the dynamics system will be a key in medical sociology that of course this. Many people live in healers that may affect their health. A person who is suffering from chronic disease cannot seek help, myopsy, or traditional healers, which is not good at this level. Next point is health system affect social inequality. It's not everyone that he or she can be able to access healthcare. For example, people that are in towns, they are able to have access to healthcare because hospitals are available than those people that are living in villages. They are not able to access healthcare because in villages they have shortage of hospitals that they can be able to go and access treatment.
Professionals, and again, explain why health system is a key thing in medical sociology. The animal guys, how is that?
It was too difficult to work
to grab So in the introduction, they're trying to say that the sociologists, these are people who study human behavior in society and its origin, just because sociology itself is just like a systematic study of studying human behavior. So the question was tackling to discuss the way of sociology. The guy was trying to study the human behavior in society. He studied the relationship between public health and again the health professionals. Public health and health professionals. Who are health professionals?
Okay. These are people who are there providing treatment patients, here as doctors or nurses or physicians.
Who have undergone a formal medical training. Not everyone.
Yes.
But once you go a formal medical training, you are a health care worker. How do you get that?
Okay, guys. Is it important in a country to have physicians? According to your research, and why?
A physician is just the same as a doctor. So that's people should.
A physician can investigate or identify.
But the question is it important to have a physician in the country?
Is
Why?
because a physician can travel a community and identify the certain cause of the disease or give them some treatment with the advice so that the disease cannot.
Are you guys in the physicians?
Yes.
Why are we not doing it? Why are we not doing it?
According to the question.
I think it's how, eh?
Okay.
I hope everyone is okay. So my name is Lily Social Media.
I'm fine today. I'm pleased from the social experience. It is number social experience.
I'm here to present the task that was given by Mr. Gode Malata. Our task explain Sabbath and Sabbath budget. So first of all,
What was the question?
explain the tax expenditure budget.
Explain the
capital expenditure budget and survival budget.
Okay.
So first of all, I give you the meaning of budget in order to make a solution. Budget is the plan that shows how much money you have and how you can spend it in a certain period of time. So I go through on capital expenditure budget. Capital expenditure budget, it's a type of budget that focuses on big or long-term items like building, factories, or offices, or buying equipment or machine that helps business to grow or improve. So in this time,
I'm here to explain the importance of capital expenditure budget. Okay. It helps high investment with the long-term goals. Second, resource allocation ensures that the funds are allocated to mostly critical or high-term projects.
We say on survival budget, as mentioned, survival budget is a document that generates plan for income spending. Survival budget is a financial plan. The financial plan needed to cover the cost needed life of the experiment. And those are the importance of survival budget. First importance is financial plan. Financial plan means it helps individuals understand the amount of money in each month or period to cover their needs.
I'll begin from the importance of survival budget. The first one is help to reduce stress. It helps reduce financial stress by prioritizing needs over wants. This is the most important need which a people need to survive in everyday life. The second one is about business survival. There are some people who does business just to help them survive the budget for their basic needs like food, shelter, electricity. That's all.
I came here to describe the developmental history of the health services in Ethiopia. And the developmental history of health services in Ethiopia. And I'll start with an introduction. The developmental health services in Ethiopia is complex and reflects in a combination of historical, social, and political factors. Below, a brief overview of the key milestones in the evolution of health services in Ethiopia. The pre-20th century. Before the 20th century, there was already a tradition in medicine where people in Ethiopia okay. In the pre-20th century, the traditional medicine was there already, where people in Ethiopia were using to treat disease and illness. And the various ethnic groups had their own traditional healing practices which were based on cultural beliefs and local medical plants. And there was also some Christian missionaries which were provided some medicine in urban areas. And the early 20th century, in early 19th, Ethiopia began to establish some hospitals. The first modern hospital was Minerigi II Hospitals, which was opened in Addis Ababa in 1902. However, the The access to health care was immediate and primary available to urban areas. Secondly is the post-World War. Post-World War is provided Ministry of Public Health. This post-World War much focus. This post-World War much focus on communicable disease, nutrition, maternal health, and child health.
Post-World War. Post-World War is provided Ministry of Public Health. This post-World War much focus. This post-World War much focus on communicable disease, nutrition, maternal health, and child health, and health infrastructure development. In Ethiopia, it provides some hospitals and clinics.
Any questions, students?
I have a question. What are the development services? The development services, they establish hospitals which helps people to have better access to health care.
Okay, question. According to the history of public health in Ethiopia, in the early 21st century, they're saying someone after getting sick, they're saying is what the cause of getting sick. In the history of public health in Ethiopia, if someone got sick, they're saying what's the cause of getting sick.
I'm so grateful, and for those who are not doing public health and nutrition, environmental, and social work, but we are here just to attend our presentation. It's again God bless you. This end of our presentation. So as I said that for those who have absconded from these presentations, the management will take an action. We had the discussion with Mr. Director, sir, and others that we need them reaching Tuesday or Monday, all the names. They will never attend the classes until they should face the sanctions for their disgusting conduct which they have done. For those who know that your name is not written in this book, make sure you should just write your name here. And I told you, I should say that I told you that the presentation will start at 8 o'clock, but most of you just come late and you are just mongering outside there. You are just putting your hands in your pockets at the bosses. Then we guys who were looking as maybe like a savage, you guys were looking at the genius outside there, just fetching for you. So that action will also take for those who come late, just because we need to teach you time management. In the work, like in different organizations where we work, we keep time. Time is very essential. Let's assume that you are about to save the patient who is serious with you, and you are just boasting you are home at your home, you are just staying at your home, you don't keep time. Will you stay at that position where you are working? They will just be exacerbate you, just remove this guy. So time management, I'll also take those names who come night time. And for those names who come late, I also make sure that we are dealing with you Despite that you are here, but we are late. So we don't tolerate unwanted things. We need to create and to build a profession. Are we together? Yeah, so we're not hating you, we're loving you. That's why we're trying to tell you these effective messages. So I'll make and we'll take for those names who came late, and we'll also deal with you. But the sanction, it will be somehow different, because though you came late, but you participate. So the sanction shall not be the same as those who have been absconded. Yeah, so for the media, before we close, if there's any issue, maybe to tell us, you are most welcome. Media, there's anything? Maybe we can just close up with your question.
I think we will have some of the few presenters for the interview. Also najusa takulandirani pano palisti pamene panali zochitika zosiyana-siyana, ndipo kunali presentation yomwe ana sukulu angapo amapanga present zomwe iwo anaphunzira. Nde apa ndi Mr. Wawa anali mmodzi mwa anthu omvera nawo presentation imeneyo. Nde ineyo ndine Hyman Kapika Msisia. Nde Mr. Zipangeni introduce now.
Mr. Kamagunda.
This is Mr. Kamagunda. Mr. Kamagunda, the way how you have seen presentation of today, have you enjoyed the presentation?
Well, frankly speaking, I would say, in the other hand, it was enjoyable presentation, but 70% it was not enjoyable presentation, just because I have seen some difficulties in the students that maybe they are failing to source the information, and that's led them not to present well at the time of presenting. But I assure that Mr. Mawanda, starting today, is also going to review the way that the students have done. Okay. So, in short, I would say it was good, partial, but the rest, it was somehow bad.
Okay. Are you having what position at this school?
Yeah, I have position.
What kind of position is it?
I can say that, first of all, I'm the lecturer.
Yeah.
And I'm also holding the position of Director of Sports and Entertainment.
Okay. As a lecturer, how could you help these students to solve the problem which you have faced today? Because you have said that some of them they did a little bit better, and the others are really complicated.
Yeah, the first thing that I can do to help these students is to edge them, so to have a time meeting the lecturers at this campus, tell them what they are facing or what is challenging them, so that the lecturers should have to know the area that they should have to work on it. Or I'm also giving them time to seek for the help from their own fellow students, because sometimes maybe they just have some shy that if they can seek help from their students, maybe they are going to underrate themselves. But starting from today, I'm urging them to seek the help from anyone else at this campus.
Okay. Thank you very much, Mr. Kamagunda. We have really appreciated because you have spent time with us, and your information hopefully will be very useful to the students of the Institute of Science and Technology and the other schools. Thank you.
Thank you.
Where we had Mr. Kamagunda, a lecturer of Longo Institute of Science and Technology. Yeah, he was clarifying to say that the student, what they did, some they did better, and some they did a little bit better, and he is encouraging the students so that they should work hard on searching the research. Thank you. My name is Hyman Kapika. Welcome, Mr.
Welcome.
This is Rongo Institute of Science and Technology Media. So I'm Kapiga Msisi, as I was said, and people that may supposed to know you. What's your name?
My name is Goran Moranda. I'm the rector and again head of department in business administration and tourism.
Mr. Moranda, you are the one who which your students were taking presentation. How have you seen the presentation?
Right, fine. Today's presentation is based on what students are presenting here. Some dropped them right, but I can give them almost 65%. Meaning to say 35% have tried, whereby 65% have failed it. I think the main challenge is the students were not serious to put their efforts to source information, and they just took their power on their hands, which has jeopardizing their presentations. And I'm really annoyed. I just get annoyed for some students did here, and I've never expected. If I can leave for this presentation and the past presentation which we had, it's very total difference. In the past presentation, students they did better as compared to this presentation.
Okay. When you know your student, isn't it?
Yes.
Yeah. What do you think would be the problem that they passed through to say that they have met these challenges of not presenting well? What would be the problem, you think?
I think the problem is most students they do think that now we're about to write exams, so we have a lot of tasks. Even if they can give us sanctions, nothing will take place, so nothing will happen. Some students are saying that we guys presentation is not much important. It's better to write exams during the time of exams rather than having presentation, of which they know nothing about, because presentation is a very great platform which builds them on how they can interact with the clients and how they can interact with the community members they don't know. So based on the challenges that we face here, if they never change, it will not be okay in their future.
In short, you are trying to mean you are supposed to teach the importance of presentation to your students, isn't it?
Yes.
Thank you very much, Mr. Moranda. And the presentation of today, you think how far will it be helping to your students? Because you have said that some they are doing better and some they are not doing better. Yeah.
Alright, fine. To summate, these guys, they are really fantastic. The only thing is we need to introduce some new strategies so that we should help those who fail to present. Some have point, but when they go in front, they are failing to figure out their points before the students just because of fear. So in the next presentation, I hope that there will be a great change because the advice that I've shared before them, and they will change because of these new strategies. One of the strategies I will try to equip these students in group discussions, and some other methods like quiz so that they should be familiar to present in a group.
We thank you very much. Lastly, we just want to mention you to talk to us so that what were your students presenting on? What is the issue? What was the task?
Right, fine. It was a protest or complex of different tasks, just because we have a student from social work, environmental science, public health, public health epidemic. So sometimes it was concerned on discuss the work of sociologists in relation to public health and professionals, and other task about the health in Ethiopia. The other task is when you need to conduct a project or to carry out a project, you need to have a budget. So some groups they took work on optimal budgets, guarantee budget, the capital expenditure budget. So these were the tasks that were emphasized very much.
Thank you very much, Mr. Moranda.
Thank you.
This is how I've talked to Mr. Moranda. This is the lecturer which his students were doing their presentation. His information to the students that he's annoyed with them because he prepared them with much resources, but they have failed to present the way how he was expecting. So we really appreciate for the time. My name is Hyman Kapiga from Risk Media team. And what's your name?
My name is Precious Wasambo, a social work student.
This is Precious Wasambo, a social work student. Today we are having a presentation. How was your presentation?
Our presentation was good. We presented all about what is social work and what all do social work do in everyday life.
Okay, on your presentation, have you seen any weakness which you have failed to say that you are supposed to improve?
Our lecturers are saying that some of us were lacking confidence in speaking. That's what it.
Okay. Okay. We really appreciate that you were doing your presentation. How is it helpful to your studies?
All right. Presentations help us if we go on the ground or when we're going to work in different organizations. This helps us to speak with confidence with people and bring out all what is needed. Yes.
Okay. Thank you very much. We are talking to Precious Wasambo, which is saying that presentation helps them as students to have confidence where they are going on ground because they are prepared to be doing their what they are going to practice them on ground. Thank you very much, Mr. Precious. Figure from List Media team, and what's your name?
William Chabwira.
William Chabwira.
Yes.
You were one of the presenters, or you were one of just the listeners of the presentation? You were presenting on what issue?
Issue of sociology, public health.
Sociology, public health. How is it helpful to present your issue on the ground the way how you did today?
Okay, because we are talking about the study of human behavior and community. So therefore, once you study, you know that for the sake of public health, you have these different issues of health promotion, disease control, and other like. So it will be important to study the community. And the resources allocation will be very easy because you are studying them.
Mr. Jamila, how was your presentation?
It was good.
It was nice. You presented very well.
Yes.
Okay. To your fellow students which were running away from this presentation, because we have heard that they are running away because it's tough presentation. How do you think it is?
Okay, because it is spirit of obligations, it will be the difficult. Once they are that amalgamation, or just run away, but not yet of our groups. But according to our group integration, we are traveled it is simple and easy, and we are presenting it very simple.
Okay, thank you very much, Mr. Chabila. Mr. Chabila is saying that the presentation was very nice and perfect. He is one of the students at the Rongo Institute of Science and Technology. And again, what program are you taking?
Public FA.
Public FA in Abima, Gabana
Abima.
Okay. He is taking Abima in public health in Abima. Yeah. Thank you. Myself, I'm the leader from media team. And what's your name?
My name is Harriet Chavula.
Harriet Chavula. Today we are one of the presenters which you are presenting information. On what issue were you presenting on?
We were presenting on sustainable development goals to the world in relation to public health.
Okay, sustainable. Okay, just tell us the importance of it on the issue which you are presenting on.
Okay, the importance of sustainable development goals, it improves the living standards of people and also it improves the health of people.
Okay. Yeah. It improves the standard of people. This information is going to the people which you are supposed to be on ground, and how is it helpful to you? The way, the fact of being presenting, doing presentation in short, is it helpful to you or to whom?
Okay, it is important to me, the presenter, and also to the people, because it helps people to have more knowledge on different issues concerning health.
Okay, what's your advice to those who haven't presented today? Because we have heard that your lecturer was saying that some they are absent from the presentations. What would be your advice to them?
Okay, my advice to them should be that they should attend, because presentation is very important as it makes people to learn more about many issues.
Okay, thank you very much. This is one of the students which we are doing presentation here at the Rongo Institute of Science and Technology, and you have said that those who are running away from these presentations, they are just killing themselves, in short, because it's more actually helpful for them when they go on ground, and it motivates them to boost their career. Thank you very much. This is Rongo Institute of Science and Technology, RIST Media Team. So don't forget to subscribe on our YouTube channel. You just search RIST Television, then you put there, subscribe and comment. Thank you.